To start today's lecture, we're going to look at some common skin disorders, and this is a continuation of the skin disorders that you examined in the skin assessment lecture. We'll look first at blisters. So blisters are also known as vesicles, and they are raised sections of skin filled with fluid. And blisters can develop from a number of different causes. So a common cause of blisters on the feet is ill-fitting shoes. What happens is the friction causes the skin to separate, and then the skin fills with fluid. Burns also cause blisters, and this can be from either burning your hand on an oven or from a sunburn. And generally blisters occur in a second-degree burn. And blisters along with swelling can happen too. Some viruses can cause blisters to develop on the skin, including the herpes simplex virus. This is involved with small blisters in clusters, particularly around the mouth and lips. And other skin conditions such as impetigo, allergic eczema, and contact dermatitis may all involve blister formation too, as well as contact with an allergen such as poison ivy. So what we can see pictured here are a couple of different examples of the blisters we just spoke about. So first we have a blister on the foot caused by friction with ill-fitting shoes. Then we have a sunburn blister and cold sore blisters. So to treat a blister, it's important to not pick or pop a blister, as that increases the risk of infection. In fact, most blisters tend to go away themselves. Applying cooling coconut oil or aloe vera gel can help reduce the inflammation, and these are also antibacterial to prevent infection. Cover blisters with bandages to keep them protected, and over time the fluid from the blister seeps back into the tissue itself. Avoid sour foods and vasodilators that increase secretions, but favor astringents. You can also prevent blisters on the feet with blister plasters and blister socks, which help reduce friction. And actually, my partner is prone to blisters. He plays a lot of sport. So coming home from soccer most weeks, he'll have quite large blisters on the sole of his feet. He was complaining about it one day, and a friend recommended he invest in these blister socks. And ever since, not a single blister has come up. So those, for anyone that suffers with blisters, those socks are worth their weight in gold. Moving on to bruising easily. So a bruise is a specific type of hematoma. This is an injury to the tissue where capillaries under the skin break and there's actually bleeding into the skin tissue. Another word for a bruise is a contusion. So what happens in a hematoma is there's a collection of blood, and this is clotted under the skin and looks like a large bruise. Blood usually drains by itself, but a very large hematoma may need medical draining. And if you've ever physically felt a hematoma, you'll be able to feel that the skin feels a little bit firmer and harder than a regular bruise. And this is because there's the blood collection just under the surface of the skin. So while most bruises are harmless and, again, resolve by themselves, some large bruises can be problematic. Swelling and blood accumulation can block circulation and can also cause healthy tissues to die. In Ayurveda, bruising easily is considered a sign of high pitta. Capillary beds are dilated, and this is a heat condition, so general inflammation or irritating toxins in the blood. Malabsorption of vitamin C and K may also be a factor in if a person easily bruises. So vitamin C plays an important role of strengthening the collagen of the skin, and vitamin K is essential for blood clotting. So if there's a deficiency in either of those vitamins or both, it's likely that a person may be more prone to bruising than a person with ample vitamin C and K. Elderly people also tend to bruise more easily, and their skin is quite fragile and thin, as are the capillaries beneath the skin. Certain medical conditions, when clotting is reduced, can also lead to more easily bruising, and some of these conditions include kidney disease, leukemia, and liver disease. As we've mentioned, most bruises resolve by themselves. However, applying cold and astringent substances can help constrict capillary beds. Cold and astringent also reduces high pitta. So cold compress and elevating the area can help reduce swelling. If somebody is bruising easily for no apparent reason, it's worth getting checked for nutritional deficiencies or any underlying medical cause. Arnica is a herb often used in skin lotions that can be applied topically to reduce bruises. And safflower and turmeric can also both be used externally on a paste, as they help move stagnant blood under the bruised skin. The next skin disorder we'll take a look at is a lipoma. So a lipoma is a growth of fatty tissue that deposits under the skin. And these are benign growths that are rarely harmful. They're usually soft to the touch and move quite easily under the skin, so they're not a rock hard mass under the skin. They're usually quite malleable. Generally, a treatment is not necessary unless the lipoma is increasing in size and is in a location that's causing some discomfort. Googaloo is used internally to scrape fatty accumulations, and castor oil packs are applied externally as well to move masses and accumulations under the skin. Purpura, also known as blood spots, is when there's purple or red spots on the skin. And this occurs when the small blood vessels or capillaries under the skin burst and actually start leaking blood into the skin tissue. It may be a sign of a blood clotting disorder, low platelet levels, or some vascular weakness. In Ayurveda, it tends to be a sign of inflammation, imbalanced blood chemistry, or metabolic toxins, ama, in the lymphatic system. And this is because ama tends to weaken the vessels and makes them more likely to rupture. So for treatment, it's advised to get checked for a blood clotting disorder or any vascular weakness. From an Ayurvedic perspective, if ama is one of the root causes, a khichdi cleanse and triphala can be used to remove ama. Reducing inflammation with amalaki. And amalaki also helps heal damaged vessels as it revives capillary beds. The next skin disorder we'll look at is varicose veins. So these are enlarged, twisted veins that tend to be blue or purple in appearance, and they most often occur in the legs and the feet. It's usually a result of blood stagnation and poor venous return from the legs. So the blood in your legs has to overcome gravity and return to the heart. So standing or sitting for long periods of time increases the pressure in the lower veins and the blood begins to pool. So walking and keeping circulation moving is essential to prevent varicose veins. Even sleeping for too long can also be an aggravating factor because as we're lying in bed for 7, 8, 9, even 10 hours, circulation can be very stagnant during that time. So veins themselves have valves that help keep the blood moving back to the heart. When the pressure gets too high, the valve can pop, and then the vein gets distended. So once one pops, the next valve has even more pressure on it. So this means that varicose veins can be quite a progressive condition. In minor cases, varicose veins don't cause problems, and they may just be a cosmetic issue for a person. However, in serious cases, there can be a higher risk of circulatory problems and risk of clots. So the risk of varicose veins increases with age. Some other factors include smoking, a family history, obesity, standing and sitting for long periods of time, also taking the contraceptive pill and pregnancy, and this is because progesterone causes blood vessels to relax. So as we mentioned, many cases of varicose veins are not considered serious. However, in serious cases, it's essential to seek medical attention. And this is because in serious cases of varicose veins, there's an increased risk of deep vein thrombosis and blood clots. And so if a clot from DVT dislodges, this can travel through the circulatory system and lodge somewhere such as the lungs, and this is known as a pulmonary embolism. So you can note that clots in superficial veins are not as a significant risk for pulmonary embolism as it would be in the case of deep vein thrombosis. Wearing compression socks can be uncomfortable, and particularly if you're pulling them on and off on a tight airplane seat. They are very uncomfortable, but often the best solution. Regular exercise and movement is essential to keep circulation flowing. Elevate the legs whenever possible. So, for example, if varicose veins are a risk and you stand or sit for extended periods of time, even just lying with legs up the wall might be a nice way to improve circulation. Reduce weight and stop smoking if applicable. Applying Brahmi oil improves the tone of veins. And internally, garlic and ginger improve circulation and reduce inflammation in the vessels. Another remedy is witch hazel, an astringent that improves the tone of the vessels in the legs. Looking now to boils. So boils are a type of skin infection that usually start in the hair follicle or an oil gland. The area tends to be red and tender and develops into a form of a small lump or bump. Over time, this lump will turn white, and this is as pus collects under the skin. And most boils are caused by a bacterial infection or a staph infection. So with boils, again, important not to squeeze as this can spread the infection. You can apply pressure with a warm, wet washcloth a few times a day, and this should encourage the boil to rupture naturally. Once it does rupture, make sure the area is kept very clean. Cover with a clean bandage to prevent the infection spreading. If there are large boils on the skin or a group of boils, medical assistance may be needed to drain the pus. Internally, alteratives clear systemic toxicity or AMA, such as mangista and triphala. Externally, pastes or poultices made from turmeric, which is antimicrobial, and tulsi, which is also antimicrobial, can be used. Fenugreek is a warming expectorant, so applied topically, it helps open the pores and drawing out the infection from a boil. And mangista can also be used topically as an anti-inflammatory. So shingles is also known as herpes zoster, and this is from the same virus that causes chickenpox, varicella zoster. So shingles is a viral infection that causes tingling and localized pain on the skin. Can develop rash, blisters, itchy, burning pain, and the appearance is similar to chickenpox. These blisters tend to occur most commonly on the torso and the face. So there is no cure for shingles, but a doctor may be able to prescribe antiviral medications and provide symptomatic pain relief. Cool baths can relieve the burning sensation on the skin, and a cool, wet compress on blisters can reduce itching. Ayurvedically, antivirals taken internally may be of assistance, including Bhumi Amalaki and Gaduchi. And externally, anti-inflammatories can help bring down the itchy, tender pain on the skin. And that would be aloe vera and neem oil. So another skin disorder is a diabetic ulcer. So this is an open wound that generally happens in around 15% of diabetes patients. They tend to develop on the legs and feet in particular, and this is due to poor circulation or edema in the lower extremities. It's generally caused by nerve and vessel damage as a result of diabetes. So how does diabetes actually affect the nerves? So in diabetes, nerves are damaged by high blood sugar levels, and this is called diabetic neuropathy. There's a strong association between lower extremity neuropathy and diabetic foot lesions. When the nerves in the lower extremities, such as the feet and leg, are damaged, this can lead to a loss of feeling and numbness in the feet. So, for example, if a person has reduced sensation in the feet, they might not be able to feel if an ill-fitting shoe is cutting off their circulation. They might not be able to tell if they scrape or graze their foot and have an open cut or wound as easy as somebody with full nervous, a full nerve function in the foot. So what can happen in this case is that somebody with diabetic neuropathy could actually be developing an ulcer and not even feel it. So diabetics should inspect feet regularly. And if a skin is broken, for example, the wound will be exposed to air and bacteria, and this is going to increase the risk of infection. So most people suffering with diabetes will go through a specific foot exam with their doctor in an annual exam to make sure that there's no lesions or wounds or problems in the lower extremities. So treatments for diabetic ulcer includes management of diabetes and regulating blood sugar levels. If there is a diabetic ulcer already formed, reducing pressure on the leg and not putting the full body weight on it, and this may be prescribed by a doctor or a physiotherapist to wear a cast boot or therapeutic shoes. It's important that a person with a diabetic ulcer doesn't go on complete bed rest, as they need to keep circulation to the foot. Can also manage the infection with antimicrobials or antibiotics. And so traditionally in Ayurveda, Katupila paste or Katupila kalka is the Ayurvedic word for paste, is a common antimicrobial that's used for diabetic ulcers. With Ayurveda, for the management of diabetes, it will be a kapha-pacifying diet, reducing sweet, thick blood, and balancing blood sugar levels with herbs such as Jemima, Bhumi Amalaki, turmeric, and fenugreek. And also vulnerary herbs or wound healing herbs such as Arjuna. So keloids are a type of raised scar. They grow much larger than the wound that caused the scar, and they result as an exaggerated healing response. So this does not affect everyone. Some people are more prone and have keloid prone skin. So basically what you can see here is potentially this person got their ear pierced, and for a normal person, a small amount of scar tissue may develop. But for somebody with keloid prone skin, you can see that the scar tissue develops far beyond what's necessary and continues to grow. There is no complete way to get rid of this excess scar tissue, so prevention is key. Of course, everybody is prone to cuts and scrapes and surgeries from time to time, so there's no way to completely avoid it, but some additional or optional ways is like if you're getting a piercing or a tattoo, that can increase the growth of this tissue. So that's something that people could choose to avoid if they know they have keloid prone skin. For medical treatment, it's usually laser therapy, surgical removal of the growth, or cryotherapy. Anti-inflammatory herbs can be used internally and externally, such as turmeric, which helps reduce excess scar tissue, and gotu kola, which is a vulnerary herb, which accelerates wound healing and may reduce scarring as it increases microcirculation. So looking now at calluses. So a callus is a section of thickened and toughened skin, and this is an adaptive response to repeated friction, pressure, irritation, in a way to protect the skin. So it usually develops on the soles of the feet, but can be found on hands, elbows, and knees, and the skin usually changes to a yellow or slightly paler color. You can see the calluses pretty prominently there on the hand, and some examples, particularly if people do a lot of manual labor or repetitive actions with the hands, a callus can develop. Most tend to disappear when the friction or pressure stops. Make sure if you're prone to calluses on your feet that you're wearing comfortable shoes and socks. May need to get calluses shaved off by a doctor if they are growing exponentially. Making sure the feet or the hands and the feet or any affected skin are very well moisturized. Soaking the feet in warm water and Epsom salt can help soften the dead skin. And then the callus can actually just be filed down with a pumice stone. Moving on to corns. So corns are a type of callus. So whereas callus covers a wider and bigger section of skin, corns are usually small, circular, and have a clearly defined center. Similar to a callus, they are also made of dead skin. Corns tend to be divided into two categories. They can be either hard or soft corns. So a hard corn is when there's a small area of thick skin similar to a callus. A soft one tends to occur more on soft areas of skin between the toes. So for example, a hard callus might happen on the ball of your foot, somewhere where there's very thick skin and the area is under a lot of pressure. And as mentioned here, the soft callus would likely occur between the toes. And the treatment for a corn is similar to a callus. What you can see there on the left-hand side is a hard corn. It looks a little bit more like a callus, the sort of paler yellow color, quite dry and rough, except it's smaller and circular in shape. Then you can see the soft corn, which is actually in between the toes and not quite as rough looking as a hard corn. So another aspect of skin disorders to examine is categorizing rashes based on palpation. So this is known as the glass test or the blanching, non-blanching rash. So press a glass against the rash on the affected skin. If the skin blanches, then redness due to blood in the vessels. If the rash doesn't blanch, the blood is in the interstitial space, and this is a more problematic sign. This is when it could be more dangerous and is a potential sign of meningitis. So if the rash doesn't blanch, that is generally the more problematic time. So this glass test is a good tool, but it's not always 100% accurate. So always seek medical attention if unsure, especially if there are other symptoms, including a fever present.